When you're going through the nursing program, you're always taught you treat all your patients the same. You have a standard of care to live up to, and no matter what the situation is, I know for me, myself, I'm gonna put my best foot forward. A lot of older people just haven't adapted to the times. They really don't know what's correct to say and what they can say and can't say anymore. I've had patients that come up to me and asking me what I'm mixed with, because there's just no way that I could be black. There's no way that my skin could look like this and not be mixed with something. There was one time where we were at clinicals, I was working with a patient that had some type of cognitive disability, and then they went on to tell me how they just couldn't believe that they let Negroes on the bus these days. A lot of times minorities do not have health care insurance, so they don't get the treatment that they need. They go undiagnosed for mental health issues. When it comes to pregnancies, a lot of women may not receive the prenatal care that they need.
I believe seeing across the country is, especially with labor and delivery, the underestimation of how much pain a woman is experiencing.
Race, especially in black females, are not taken as serious.
I do know that a lot of the big hospital systems now do require us to have training in like cultural biases and competencies, but how many actually pay attention to that, I can't say. But I will say is people are aware that there is an issue. Now, how much they understand how much it impacts people's life, that would be the question.
Saying the Negroes or half-breeds when they talk about mixed people.
I saw a lot of disparities in the way my parents were treated when they would go to the doctor.
I do know that, years ago that was something that was taught, that black women or black people in general were able to tolerate more pain, so they didn't need as much medication and generally just weren't getting treated as fairly inside of the hospital.
It just made me feel like our care was based off our socioeconomic status and not necessarily our healthcare status. So I wanted to be a victor and not a victim. I just did not feel right and I did not feel comfortable. And I wanted to come back to my community and educate others. In 2006, I was pregnant and I just became a new nurse in the Army. And when I got to my new duty station at Fort Benning, Georgia, I was having issues with my leg, and I think I was about 32 weeks pregnant. I went to the doctor's office. He established a report with me. He listened to my concerns, but my blood pressure was elevated. It's like 140/90. For someone who had blood pressure problems prior to pregnancy, I didn't think anything of it. But because he listened to my concerns, I listened to his concerns, and he wanted to admit me. That night, had he not admitted me, I probably would have died. So I listened to him, and he saved my life.
One thing I explain to my patients is I give them their voice. I say, you have to advocate for yourself. I wouldn't rely on, your doctor, not that we're not reliable, but we're not there sometimes. So it can be not necessarily from your provider, it can be from the nursing staff, or it can be from the housekeeping staff. But you have to speak up for yourself. Ask questions, and if they don't answer your question, ask, can I speak to someone else who could answer this for me? Write down questions. If you don't understand it, you can always write down and come back to it later. But you have to be your own advocate.
With the mortality rates in black women when it comes to childbirth, it really just makes me wonder why. What are these problems? And for me, it's a concern. If I have kids, why is this a thing? Why should this even be something that we're looking at? Because honestly, there should be no drastic difference. And it makes me wonder if these unconscious biases that sometimes doctors can have is still a prevalent problem, and what we can do to put those in check to make sure that this doesn't happen to people, get those numbers down.
It's just heartbreaking to understand that they're not being treated the same or cared the same only due to their color, or just stigmatism that's already in place. And I would want everyone to be treated equally and honestly be held to the same respect of treatment that everyone deserves.
You have to advocate for yourself. Like I said, ask questions if you don't understand. If you're having an issue and it seems like it's being ignored, or you giving a medication that's not working, speak up.
Do you think some black people don't trust the healthcare system due to past factors?
Absolutely, it's historical.
I know about Black women and the pregnancy mortality rates, that it genuinely is a problem and it's not as talked about as much as it should be. I think it might come from back in the day when they were teaching that Black women have a higher pain tolerance than other people. And so they just assume that, some Black people are being dramatic when they're in the hospital and don't need these certain things. And I'm grateful for my knowledge and what I have, and that's something that I'm going to stay on top of. If I become pregnant and have kids, I'm going to be on top of the doctors and knowing what should be looked at and knowing what tests to order and all of that. But it does make me hesitant just because I know what could happen, what's a possibility.
I see the future of maternity health as bright, but I also see large opportunities for growth and for us to excel in the healthcare field.
Education is always key. So if a patient doesn't understand something, it's just being there for them and constantly explaining it and knowing that I'm their advocate and that I'm there for them and that I'm doing my best to try to help them. So just constantly being there to reassure. And like I said, having the family background where I know some people can be uncomfortable in the medical field, just trying to be that person that can really lean on them or be there for them in their time of struggle.
I want to make sure that I produce nurses that are competent, compassionate, and culturally astute. And also I want to make sure that my nurses are advocates for all their patients, especially those who feel that they don't have a voice. I believe it's important that we establish a rapport with our healthcare providers. When you know someone, you would trust them and you would know that they have their best interests or your best interests at heart. I believe it's very important for a provider-patient relationship.
I feel like going forward, just be willing to have conversations and be willing to listen and hear other stories is a lot more effective than not having the conversation at all.
They might not have the money and jobs, so they don't have the money to pay for a hospital stay or hospital visit, so they just choose to wait it out until it's too late. So it's just bringing awareness to that fact and seeing if there's anything we can do to get more coverage for these people, and just being understanding. If someone comes into the hospital and you're thinking, why'd you wait so long to come in? But knowing that they might not have had those resources to do it in the beginning.